Introduction to allergies. Allergies are a common phenomenon affecting millions of people worldwide. They occur when the body's immune system mistakenly identifies a harmless substance, such as pollen, dust mites, or certain foods, as a threat. This misidentification leads to an overreaction, resulting in the release of chemicals that cause a variety of symptoms, ranging from mild discomfort to life-threatening reactions. But why does this happen? To understand allergies, we need to look at the immune system and how it normally functions. The immune system is a complex network of cells, tissues, and organs that work together to protect the body against foreign invaders, such as bacteria, viruses, and other pathogens. It does so by recognizing these invaders and mounting an appropriate response to eliminate them. However, in the case of allergies, this response is inappropriate and excessive, leading to the symptoms we associate with allergic reactions. The substances that trigger allergies are known as allergens, and they can be found in the air we breathe, the food we eat, and even on the surfaces we touch. Common allergens include pollen from trees, grasses, and weeds, dust mites, mold, pet dander, and certain foods like peanuts, tree nuts, fish, shellfish, milk, eggs, wheat, and soy. Each of these allergens has the potential to trigger an allergic reaction, which can range from mild symptoms like sneezing and runny nose to severe reactions like anaphylaxis, a life-threatening condition that requires immediate medical attention. The immune system and allergic reactions. At the heart of allergic reactions is the immune system's overreaction to harmless substances. When an allergen enters the body, it is recognized by immune cells called T cells and B cells. These cells then trigger the production of antibodies, which are proteins designed to fight off the perceived threat. In the case of allergies, the antibodies produced are primarily of the IgA type. IgA antibodies bind to the allergen and to mast cells, which are a type of immune system cell involved in the allergic response. This binding causes the mast cells to release a variety of chemical mediators, including histamine, leukotrienes, and cytokines. These chemicals are responsible for the symptoms of an allergic reaction. Histamine, for example, causes blood vessels to dilate, leading to increased blood flow, which manifests as redness and swelling. It also stimulates the mucous membranes to produce more mucus, resulting in a runny nose and congestion. Leukotrienes are involved in the constriction of airway muscles, which can lead to wheezing and difficulty breathing in the case of respiratory allergies. Understanding the role of the immune system in allergic reactions is crucial for developing effective treatments and management strategies. By targeting the specific steps in the allergic response pathway, healthcare providers can offer relief from symptoms and, in some cases, desensitize patients to specific allergens. Types of allergies. Allergies can be categorized into several types based on the symptoms they cause and the parts of the body they affect. Respiratory allergies, such as hay fever and asthma, affect the lungs and airways. They are triggered by allergens like pollen, dust mites, and pet dander. Symptoms can include sneezing, runny nose, itchiness, coughing, wheezing, and shortness of breath. Food allergies occur when the immune system reacts to certain foods, leading to a range of symptoms from mild hives to life-threatening anaphylaxis. Common food allergens include peanuts, tree nuts, fish, shellfish, milk, eggs, wheat, and soy. Skin allergies, such as atopic dermatitis, eczema, and contact dermatitis, affect the skin. Atopic dermatitis is a chronic condition characterized by itchy, inflamed skin, while contact dermatitis is a reaction to substances that come into contact with the skin, like metals or certain chemicals. Insect sting allergies are severe reactions to the venom from certain insects, like bees, wasps, and fire ants. These reactions can range from localized swelling to anaphylaxis. Drug allergies are adverse reactions to medications, which can manifest in various ways, from mild rashes to anaphylaxis. Understanding the specific type of allergy is crucial for managing symptoms and preventing severe reactions. Symptoms of allergic reactions. The symptoms of allergic reactions can vary widely, depending on the type of allergy and the individual's sensitivity. Mild symptoms might include sneezing, runny or stuffy nose, itchy, watery, red, or swollen eyes, coughing, wheezing, skin rashes, and itching. More severe reactions can involve swelling of the face, lips, tongue, or throat, which can lead to difficulty breathing. Anaphylaxis, the most severe form of an allergic reaction, is a medical emergency characterized by symptoms such as constricted airways, leading to wheezing, coughing, shortness of breath, or rapid breathing, rapid heartbeat, dizziness or fainting, confusion or loss of consciousness, and a drop in blood pressure. Recognizing the symptoms of an allergic reaction is crucial for providing appropriate care. For mild to moderate symptoms, over-the-counter medications like antihistamines and corticosteroids can provide relief. However, anaphylaxis requires immediate medical attention, typically involving the administration of epinephrine via an auto-injector, such as an EpiPen, followed by emergency medical care. Diagnosing allergies. Diagnosing allergies involves a combination of medical history, physical examination, and specific tests. The first step is typically a detailed medical history to identify potential allergens and assess the severity of symptoms. A physical examination can provide clues about the type of allergy, such as skin rashes or respiratory issues. Specific tests include skin prick tests, where a small amount of an allergen is placed on the skin to observe the reaction, blood tests, which measure the levels of allergy-related antibodies in the blood, and elimination diets, used to diagnose food allergies by removing and then reintroducing suspected foods to monitor symptoms. In some cases, a healthcare provider might recommend an oral food challenge, a medical procedure where the patient is given increasing amounts of the suspected food allergen in a controlled environment to assess the reaction. Diagnostic tests help determine the presence and severity of an allergy, guiding the development of a treatment plan. Accurate diagnosis is crucial for managing allergies effectively and preventing severe reactions. Treating and managing allergies. Treating and managing allergies involve a multifaceted approach, including avoidance of known allergens, use of medications to alleviate symptoms, and in some cases, immunotherapy to desensitize the patient to specific allergens. Avoidance is the most effective way to prevent allergic reactions and is particularly crucial for severe allergies. Medications can provide relief from symptoms. Antihistamines, decongestants, and corticosteroids are commonly used. For severe allergies, especially those that can cause anaphylaxis, carrying an emergency injector like an EpiPen is recommended. Immunotherapy, or allergy shots, is a long-term treatment that aims to desensitize the body to specific allergens. It involves regular injections of small amounts of the allergen, gradually increasing the dose over time. This can significantly reduce the severity of allergic reactions and, in some cases, provide long-term relief. Sublingual immunotherapy, where the allergen is placed under the tongue, is another form of desensitization. Managing allergies also involves being aware of cross-reactivity, where sensitivity to one allergen might trigger reactions to others. A comprehensive treatment plan, developed in consultation with a healthcare provider, is essential for effectively managing allergies and improving quality of life. Prevention of allergies. While it's not possible to completely prevent the development of allergies, there are steps that can be taken to reduce the risk and manage existing allergies. For infants and young children, breastfeeding has been shown to have a protective effect against the development of allergies, particularly if the mother avoids common allergenic foods during pregnancy and lactation. Introduction of solid foods should be done in a gradual and controlled manner, with potential allergens introduced one at a time to monitor for any adverse reactions. Maintaining a clean environment can reduce exposure to allergens like dust mites and mold, but over-sanitization can also have negative effects on the immune system's development. Pets, especially dogs and cats, can bring allergens into the home, so pet owners with allergies need to take extra precautions. Regular vacuuming, using HEPA filters, and keeping pets out of bedrooms can help reduce exposure. Understanding the genetic component of allergies is also important, as individuals with a family history of allergies are more likely to develop them. While prevention strategies are not foolproof, they can contribute to a reduced risk and better management of allergies. Future of allergy research and treatment. Research into allergies and the immune system is ongoing, with scientists exploring new treatments and potential cures. One area of interest is the role of the microbiome, the community of microorganisms living in and on our bodies, in the development and management of allergies. Studies have shown that an imbalance in the microbiome, also known as dysbiosis, can contribute to allergic diseases. Probiotics and prebiotics, which support the health of the microbiome, are being investigated for their potential to prevent or treat allergies. Gene therapy and immunomodulatory therapies are also under investigation, aiming to modify the body's immune response to allergens. Another promising area is the development of more effective and safer forms of immunotherapy, including sublingual immunotherapy and epicutaneous immunotherapy, where the allergen is applied to the skin. As our understanding of the immune system and allergic reactions deepens, so does the potential for developing more targeted and effective treatments. The future of allergy management holds much promise, with the potential for not just better symptom control, but also for true desensitization and possibly even cures for specific allergies. Conclusion: allergies are a complex and multifaceted phenomenon, affecting millions of people worldwide. Understanding the science behind allergies, including how the immune system works and why it sometimes overreacts to harmless substances, is crucial for developing effective treatments and management strategies. From the common symptoms of allergic reactions to the latest in research and treatment options, the field of allergy science is both fascinating and rapidly evolving. As we continue to explore the intricacies of the immune system and its responses, we move closer to a future where allergies can be not just managed but potentially cured. For those living with allergies, staying informed and working closely with healthcare providers is key to navigating the challenges and opportunities in allergy management. By supporting ongoing research and advancements in the field, we can look forward to a future with better treatments, improved quality of life for those with allergies, and perhaps one day, a world where allergies are a rarity rather than a common occurrence.